Atherosclerosis Prevention. Prescribon Medical Education Series. Atherosclerosis Prevention is a two-part series. This is part 1. How atherosclerosis affects arteries is explained in detail in Prescribon Medical Education Series, Atherosclerosis Part 1 and 2. Atherosclerosis affects most arteries in the body, including arteries in the heart. That is coronary artery disease, CAD, most commonly. Brain, stroke, less commonly. And in arms, legs, pelvis and kidneys, much less commonly. Diseases affecting humanity can be divided into 4 common stages on a time scale. First, the age of pestilence and famine. Before 1900s, infectious diseases and malnutrition were the commonest causes of death, with tuberculosis, pneumonia and diarrhea accounting for the majority of deaths. The mean expectancy of life was 30 years only. Next, the age of receding pandemics. This age saw the initiation of public health measures, that is hygienic houses, clean floors, walls and roof due to improved economy, personal hygiene, keeping body clean, clean drinking water, food, vegetables and fruits, proper disposal of excreta, that is clean toilets at home instead of defecation in the open, proper disposal of waste, proper disposal of excreta, that is clean toilets already told, and cleaner water supplies, that is safe drinking water. These reduced the occurrence of death from infectious diseases. Age of degenerative and man-made diseases. Economic conditions improved in this age. Urbanization continued. Well-paying jobs mainly in cities and work-related activities changed lifestyle patterns. These led to dramatic changes in diet, that is increased availability of less nutritious, less roughage, high calorie, high fat diet, decreased physical activity, no time for physical exercise, less time for healthy relaxation of body and mind, instead indulging in unhealthy smoking and alcohol. Life expectancy became much higher, but the incidence of atherosclerosis became much commoner. Commonly, heart diseases and stroke predominate. Coronary vascular disease, CVD, accounts for 35 to 65% of all deaths. Stroke accounts for about half the deaths of coronary vascular disease, that is CVD. Then came the age of delayed degenerative diseases, that is coronary vascular disease and cancer remain the major cause of morbidity, that is disease burden, and mortality, that is death rate. Now, the age of inactivity and obesity. In many parts of the industrialized world, physical activity continues to decline while total calorie intake increases at alarming rates, resulting in an epidemic of overweight and obesity. Consequently, type 2 diabetes, hypertension and lipid abnormalities associated with obesity are rising, a particularly evident trend in children. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. The burden of Atherosclerosis. Atherosclerosis remains as an asymptomatic disease for years until acute sudden events take over, with events related to heart as a heart attack with symptoms like discomfort or pain in chest, shortness of breath, pain or discomfort in the jaw, neck, back, arm, or shoulder, feeling nauseous, lightheaded, or unusually tired, or events related to brain as a stroke with symptoms like sudden numbness or weakness in face, arm, or leg, especially on one side of the body, sudden confusion or trouble speaking, very slurred speech, sudden trouble for seeing in one or both eyes, sudden trouble for walking, dizziness and loss of balance, or lack of coordination. This suddenness of onset of symptoms is called the silent killer disease. Atherosclerosis is considered the major cause of cardiovascular disease, that is CVD. Ischemic heart disease, that is IHD, that is reduced or absent blood supply in the coronary arteries, the blood vessels supplying the heart, is the number one cause of death world over. And stroke is the fifth cause of death. Global scenario. Cardiovascular diseases are the leading cause of death. In 2019, 18 million people died from cardiovascular diseases, representing 32% of all global deaths. Of these, 82% were due to heart attack and stroke. Over 3/4 of cardiovascular diseases take place in low and middle income countries. In the US, every year, about 730,000 have heart attack. Heart disease accounts for 1 in 4 deaths. About 600,000 people die of heart attack. 75% of myocardial infarctions, MI, that is, infarction means death of a localized, that is a small area of myocardium, that is the heart muscle. The infarctions are due to plaque rupture. For explanation of plaque rupture, see Atherosclerosis Part 1 and 2 in this Prescribon medical education series. Stroke is a major cause of serious long-term disability. About 790,000 people suffer from stroke, resulting in 140,000 deaths every year in US. Indian scenario. 45 million people are suffering from coronary artery disease, that is CAD. Coronary artery disease accounts for 1/3 of all deaths. Heart disease occurs 10 to 15 years earlier in India than in Western people. The unfortunate tragedy is that most cardiovascular diseases are preventable by paying serious attention to 1. Avoidance of tobacco, unhealthy diet, obesity, physical inactivity, and alcohol. The risk factors for atherosclerosis and their percentage risk are, the modifiable risk factors are elevated blood pressure, 54% risk, cholesterol, 32% risk, obesity and overweight, 18%, tobacco, 18%, diets high in fat and salt, and lack of physical activity. Elevated levels of blood pressure and cholesterol remain the leading cause of coronary heart disease. Now we will look into these risk factors. Hypertension, that is elevated blood pressure, that is BP. More than 1 billion people suffer from hypertension worldwide. Hypertension is defined as systolic blood pressure, that is the upper value, that is the pressure achieved because of the contractile force of the heart, that is 140 millimeters of mercury or higher, and diastolic level, that is the lower level, 90 millimeters of mercury or higher pressure during the resting stage of the heart. Treating hypertension. BP reductions as small as 3 to 5 millimeter of mercury result in large and clinically significant reductions in risk for stroke, vascular mortality, congestive heart failure, and coronary heart disease. Diet and lifestyle management remain the cornerstone of prevention of hypertension. Nearly half of the hypertension patients do not have ideally controlled blood pressure. Patients in US spend $131 billion for medical expenses of hypertension and $25 billion for lost productivity. By 2030, the total cost of blood pressure will increase to $340 billion. By 2025, there will be 1.5 billion blood pressure patients worldwide. It causes 7 million premature deaths worldwide annually. 80% of the burden occurs in low and middle income countries. In developing countries, urbanization, aging population, changes in dietary habits, poverty, and high cost of drugs all contribute to poor blood pressure control. The risk factors for development of hypertension are age, racial and family background, family history, lower education and socio-economic status, overweight and physical inactivity, tobacco use, dietary factors, that is increased dietary fats, higher sodium intake, that is salt, less potassium, that is they are more in vegetables and fruits. If you take less, there will be less potassium, alcohol, chronic kidney disease, metabolic syndrome, that is a combination of high blood sugar, low levels of HDL, that is good cholesterol in the blood, high levels of triglycerides in the blood, large waist circumference or apple-shaped body, and high blood pressure, and diabetes. Elevated blood pressure is a major risk factor for coronary artery disease, that is coronary heart disease, renal failure, cerebrovascular disease, that is stroke, peripheral artery disease, atrial fibrillation, that is ineffectual, irregular and rapid contraction of the upper chambers of the heart, increased death rate, loss of higher function of the brain like loss of recognition of sensation, intuition, thinking and feelings, dementia, that is impaired ability to remember, think or make decisions which interfere with everyday activities, and Alzheimer's disease is the most common type of dementia. Cholesterol. Cholesterol is essential for the body for maintenance of healthy cell wall, production of hormones and vitamin D, and to perform various other important functions. The body needs 800 mg per day of cholesterol. All the body needs are supplied by the liver. There is no need of supply of cholesterol through foods. Cholesterol-rich foods are red meats, eggs. Per egg yolk 200 mg, saturated fats 1.5 gram, and dairy products. Most foods that are rich in cholesterol are also high in saturated fatty acids, and these increase the risk for cardiovascular diseases. Foods that have no cholesterol are fruits, vegetables, grains, seeds, nuts, beans, peas, and lentils. Foods that lower the low density lipoprotein cholesterol, that is bad cholesterol, are oats, barley, whole grains, they have more fibers. Beans is also rich in fiber. Eggplant, that is brinjal, and okra, that is lady's finger, tomatoes, non-starchy vegetables such as leafy greens, broccoli and cauliflower, all nuts including peanuts, vegetable oils like canola, sunflower, coconut oil, sesame oil, groundnut oil in place of animal fats like butter and lard. Apples, bananas, grapes, strawberries, papaya, pineapple, citrus and other fruits, they are all rich in soluble fiber, that is pectin. Soya beans and fatty fish, which has LDL lowering omega-3 fats, which reduce triglycerides in blood and helps prevent the onset of abnormal rhythms in heart. Nowadays, getting fish without chemical preservatives or getting fish from unpolluted waters is difficult. Meat, unlike fish, has bad LDL boosting saturated fats. If at all cholesterol containing foods are to be included, keep it to a minimum. Cholesterol should be limited to less than 250 milligrams per day and much less if dyslipidemia, that is enhanced blood levels of LDL cholesterol and triglycerides, is present. Obesity. Obesity is increasing throughout the world and particularly in low and middle income countries. 1.6 billion adults were overweight, that is body mass index BMI more than 25 kilograms per meter squared in 2008. Of these, 502 million were obese, that is BMI over 30, that is kilogram per meter square. Now a little bit about body mass index. Body mass index is a measure of body fat based on a person's weight in kilograms divided by the person's height in meters, which is squared. BMI less than 18.5 is underweight. Between 18.5 and 24.9 is a healthy range. Between 25 to 29.9 is overweight, and more than 30 means obese. The increased prevalence of obesity is due to changes in dietary pattern, that is increase in animal food consumption, physical inactivity, that is increased use of motorized vehicles and sedentary occupations, which are higher paying as compared to lower paying hard work related occupations. Adolescents are particularly at high risk. The number of overweight children are increasing throughout the world, be it in US, China, Brazil, India, Mexico and Nigeria. 40 million children younger than 5 years are overweight now. Diet. Human history has mostly seen undernourishment and malnutrition. Famine and diseases were very common. So, the adaptive mechanisms of the body over centuries worked to conserve and store extra food as fat as a defense against famine. This mechanism has now become unfavorable because of easy availability of large portions of foods. Example, king-sized combo meals, processed foods, and energy drinks. As economy improves and personal income increases, food consumption also increases, especially high-calorie foods, animal-based foods, fats, and carbohydrate. Intake of plant-based food decreases. A key element of this dietary change is the increased intake of saturated animal fats, reducing total energy intake. Fats. Reduce fat intake. Fat-rich foods have the highest energy density, that is 9 calories per gram. They also have poor satiating effects and so tend to encourage overeating. Carbohydrate and protein have energy density of only 4 calories per gram. The initial target should be a 10% loss of starting weight. A 10% weight loss may take several months. Weight loss by a small but tolerable change in lifestyle is much more likely to be maintained than weight lost by a crash diet. As weight falls, resting energy expenditure also declines. Resting energy requirement depends on the body weight. A leaner person needs lesser energy at rest than an obese person. At the same dietary levels, initially the body weight may decrease more. Later, as the body weight becomes less, the same amount of food may result in lesser body weight decrease or even the same body weight being maintained. Hence, dietary restrictions may have to be carefully adjusted. Months of careful dietary restrictions may easily be compensated by a few days of careless overeating. Fat should provide less than 15 to 30% of total energy intake. Nowadays, in most industrialized countries, it accounts for 40%. Vegetable oils. Polyunsaturated oils, example sunflower oil, or monounsaturated oils like olive oil, are preferred to saturated animal fats, even though all types of fats or oils have the same energy density, that is 9 calories per gram, and therefore equally obesity maintaining. Vegetable oils are unsaturated oils and contain no cholesterol. Unsaturated oils lower body's atherosclerosis contributing LDL, that is bad cholesterol. Animal fats contain saturated fats and cholesterol. Saturated fats increase the level of atherosclerosis contributing LDL, bad cholesterol. The cholesterol content in various foods in milligrams per 100 grams are meat 73 milligram, chicken 88 milligram, pork 80 milligram, eggs 373 milligrams per 100 gram, but per egg 200 milligrams. Fish 63 milligram, vegetable oils 0 milligram. Ideally, animal fats should be avoided altogether. At the very maximum, they should comprise less than 10% of total energy intake. The lesser, the better. And so, my dear listeners, this is the end of part 1 on prevention of atherosclerosis. For part 2, see the video Atherosclerosis Prevention Part 2 of Prescribon medical education series.